Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the sciatic nerve. The sciatic nerve is the largest and thickest nerve of our body. It is formed from the sacral plexus, from the ventral rami of L4, L5, S1, S2, S3. So, this is the largest and the thickest nerve of the body. And it is formed from the sacral plexus by the ventral rami of L4, L5, S1, S2 and S3 in front of the piriformis muscle. Okay, so these are the ventral rami of L4, L5, S1, S2, S3. The sciatic nerve has two components. One is the tibial part, another one is the common fibular part. Two components. One is the tibial part, another one is the common fibular, also called peroneal part. Okay, so tibial part and common peroneal part of the sciatic nerve. So tibial part is formed by the ventral division of the ventral rami of L4, L5, S1, S2, S3. So these are the ventral divisions. Okay, so tibial part is formed by the ventral divisions of the ventral rami of L4, L5, S1, S2 and S3. So this is ventral rami 1, 2, 3, 4, 5. These are divided into ventral division, and the red is the dorsal division. This is the dorsal division. Okay. From the ventral divisions of the ventral rami of L4, L5, S1, S2, S3, formation of tibial part of the sciatic nerve. From the dorsal division of L4, L5, S1, S2, so it is formed by the tibial part is formed by the ventral divisions of the ventral rami of L4, L5, S1, S2. Common fibular part is formed by dorsal division of the ventral rami of L4, L5, S1 and S2. So to know that the S3 does not contribute in the formation of the common fibular part. S3 contribute in the tibial part. So this dark is the tibial part of the sciatic nerve. This red is the common fibular part of the sciatic nerve. This is the common fibular part of the sciatic nerve. So this is the common fibular, or also called peroneal, old term, fibular, you can write it here, peroneal part of sciatic nerve, So what is my sciatic nerve? This together is the sciatic nerve. So this part is the part of the sciatic nerve. Okay, we got sciatic nerve, two component, common fibular component, tibial component. Tibial components is coming from the ventral divisions of the ventral rami of L4, L5, S1, S2, S3. The common fibular part is arising from the dorsal divisions of the ventral rami of L4, L5, S1, S2, not S3. Okay, we got the formation of the sciatic nerve. Now we will go through the course of the sciatic nerve. Course. The sciatic nerve passes below the piriformis muscle. Okay. Passes beneath the piriformis muscle. From the pelvic cavity, we can call from the true pelvis, the pelvic cavity to the gluteal region. Okay. So this is a part of the pelvic cavity. This is the sacrum. Our piriformis is here. Piriformis muscle on both sides, E-shaped origin from the sacrum. So in front of it, there is formation of the sciatic nerve. It passes beneath the piriformis muscle. Piriformis muscle comes out of the pelvic cavity through the greater sciatic foramen area here. Okay, so it passes beneath the piriformis, that is inferior to the piriformis, and goes from pelvic cavity to the gluteal region. Okay. Okay. So to know that part. It is covered by the gluteus maximus. Okay, it is covered by the gluteus maximus muscle. And we have some relationship to the sciatic nerve below the piriformis. It is lateral to the inferior gluteal vessel, pudendal nerve, and the internal pudendal vessels. Okay, we got the relationship below the piriformis. It is covered by the gluteus maximus. It does not supply any muscles in the gluteal region. Okay, we got that. And this is the thickest nerve of the body. It is around 2 centimeters in diameter. Okay, it has its own blood supply from the inferior gluteal artery. We call it, okay, it is supplied by, this nerve is supplied by a branch of inferior gluteal artery, and that is called arteria comitans nervi ischiadici. Arteria comitans nervi ischiadici. Okay, we got the blood supply of the sciatic nerve, and we know that it passes underneath the piriformis. It is lateral to the inferior gluteal vessels, pudendal nerve, and internal pudendal vessels. It is covered by the gluteus maximus. It does not innervate any muscles of the gluteal region. Okay, then it passes between the, then in its course, okay, let's continue on the course, passes between the ischial tuberosity and the greater trochanter of the femur. Okay, so it passes between the ischial tuberosity. This is ischial tuberosity. This is a greater trochanter in between. Then it passes between the ischial tuberosity and greater trochanter. Okay, then between the greater trochanter, tuberosity and greater trochanter femur, and courses on the back of the thigh. Okay, so its relationship here at the back of the thigh, it is covered by the biceps femoris muscle. Okay, and is covered by the long head of biceps femoris. Okay, so in its course, this nerve is long, so it is a part of that. It goes, okay, so it goes over multiple muscles. So relationship of the sciatic nerve, we got it is covered by the gluteus maximus and by the long head of biceps femoris. What structure is anterior to it? Okay, the following structures are deep to the sciatic nerve. Okay, these are the ischium. You can call the root of the ischial spine, okay, the gemellus superior, the obturator internus, gemellus, inferior, then the quadratus femoris, okay, then the adductor magnus. The posterior femoral cutaneous of the thigh may be posterior to the sciatic nerve, okay, or it may be medial to the sciatic nerve, the posterior femoral cutaneous nerve. The sciatic nerve, deep to the sciatic nerve, we also get the ascending branch of the medial circumflex femoral artery as well as nerve to the quadratus femoris. Okay, these are the structure deep to it. Then where it terminates. So if we extend that, the sciatic nerve, it is just behind the thigh. So at the apex of the popliteal fossa here, okay, it divides into two. One is the tibial nerve here, one is tibial nerve, another one is the tibial nerve, another one is the, okay, so you can make it dark, okay, the tibial nerve, make it dark, okay, this is the tibial nerve, the larger division is the tibial nerve, this is the tibial nerve, and we have also the common fibular. So these are the divisions of the sciatic nerve. Okay, this is the common fibular nerve, also called common peroneal nerve. This is the tibial nerve. This is the tibial nerve. This is the sciatic nerve. Where this division takes place, this is the apex of this area is called popliteal fossa. Okay, so where is the landmark for popliteal fossa apex? This is the apex of the popliteal fossa. This is, okay, it is the apex of the popliteal fossa. This is the junction between between the upper 2/3 and lower 1/3 of the back of the thigh. So we got the division of sciatic nerve at the apex of the popliteal fossa. This is at the junction between the upper 2/3 and lower 1/3 of the back of the thigh. Okay, so we got the sciatic nerve. Now we have to find out the branches of the sciatic nerve. Sciatic nerve supplies what structure? We'll not go to the branches of these divisions, or we'll go to the muscles supplied by the sciatic nerve. Okay, muscles innervated by the sciatic nerve, directly from the sciatic nerve, not from the major branch contributions. From the sciatic nerve, we have muscles innervated by the sciatic nerve. These are the hamstring muscles. What are the hamstring muscles? All the hamstring muscles takes origin from the ischial tuberosity. These are the semimembranosus, semitendinosus, the biceps femoris long head, and the ischial part of the adductor magnus muscle. Okay, these are the biceps femoris long head, not the short head, long head, semimembranosus, semitendinosus, and the ischial part or adduct or the hamstring part of the adductor magnus. So if we go to make these muscles, getting nerve supply here, it getting nerve supply, it is getting nerve supply. If I draw, this is the part of muscle getting nerve supply. Okay, so we got these muscles getting innervation from the tibial part of the sciatic nerve. All the hamstring muscles are innervated by, hamstrings are innervated by the tibial part of sciatic nerve, Okay. How about the common fibular part of sciatic nerve? Okay. Here, short head of biceps, short head of biceps femoris is innervated by the by the common fibular part of sciatic nerve. Fibular part of the sciatic nerve. Okay, we got the muscles innervated by the sciatic nerve. This is our sciatic nerve. Okay. Okay. So this is the sciatic nerve. The tibial part innervates the biceps femoris long head, the semimembranosus, okay, the semimembranosus, semitendinosus, ischial part of the adductor magnus, and all the hamstring muscle takes origin from the ischial tuberosity. We got the muscles innervated by the sciatic nerve. Okay, these are the hamstring muscles. All the hamstrings innervated by the tibial part of sciatic nerve. The common fibular part of sciatic nerve innervates the short head of biceps femoris. We got that. Okay, we got the relationship. Now, as because the sciatic nerve passes over the hip joint, it is also related to the capsule of the hip joint. So it is articular branch, to the hip joint between the femur and the hip bone, head of the femur and the hip bone. Okay, hip joint or acetibulofemoral joint. Okay, we got the muscles innervated by the sciatic nerve. Now we learn some clinical anatomy. Okay, so clinical anatomy. Okay. First of all, we must recognize that around 12 to 15% population, this nerve may be splitted. It may be two, it may be divided. They are actually coming close together, the tibial part and the common fibular part by connective tissue, but they may split not at the apex of the popliteal fossa, they may split in the pelvis. So we have variation that is very important. The common fibular part may come out of the pelvis above the piriformis. That is possibility. Okay, or through the piriformis, through the substance of piriformis. Okay, that is very common, around 12 to 15% cases, piriformis. Okay, this is one. In that condition, the tibial part passes beneath the piriformis. Okay, this is the variation. We got that variation. We have a syndrome called piriformis syndrome. Okay, so the part of the sciatic nerve may be irritated due to some pathology or changes in the piriformis muscle. This is seen especially in case of skating, ice skating, also in ice hockey and other type of athletes, especially in females. It is called piriformis syndrome. Another problem is called resting foot syndrome. Resting foot syndrome. Okay. Between the quadratus femoris and the adductor magnus, the sciatic nerve may be in contact with the very close to the bone. Okay, a person is sitting for a long time on a hard object, on a chair, the sciatic nerve may be compressed and there may be loss of sensation as well as loss of function of the muscles below the knee, and also there may be different sensation at the back of the thigh. There is the resting foot syndrome. Okay. We also call it sleeping foot syndrome. That is the sleeping foot syndrome. Okay. So that is the condition when a person is sitting for a long time on hard object and the sciatic nerve is compressed against the capsule of the hip joint or the femur. Okay, so that may lead to the weakness of the muscle below the knee, and also there may be different sensation in the back of the thigh and the skin on the lateral and posterior part of the leg, as well as the plantar surface of the foot. Okay, that may be a possibility. Okay, so we may have, if this is the condition, we may have another condition that is called sciatica. This is a condition when the nerve root contributing in the formation of sciatic nerve is compressed. This may happen due to intervertebral disc prolapse. Vertebral disc prolapse, especially the herniation of the nucleus pulposus through the annulus fibrosus, or there may be some type of pelvic tumor. So there may be sciatica tumor, pelvic tumor, or some type of fibrositis, osteoarthritis,